Mr. President, at some point this evening, we expect the House of Representatives to send the Senate a bill that would keep the federal government open for another few weeks before heading home for Christmas. For most families, the holidays are an opportunity to take a break away from our busy lives and enjoy time with the people we love. It's safe to say, however, that won't be the case for tens of thousands of American families who have lost a loved one this year to a drug overdose. The Centers for Disease Control released two important new reports this week. First, they found that life expectancy decreased in the United States for the second year in a row. Second, the likely cause of that decrease? In 2016, over 63,000 people died of a drug overdose. That's more than 144 deaths per day. It's a 21% increase from 2015. This is a crisis. People are dying in communities across this country every single day. Congress must do much more to address this scourge. Here in Washington, we've talked at length about the massive size and scope of the problem. Last year, we passed bipartisan legislation that was signed into law and is providing our local communities with more tools to fight the epidemic. And we approved initial funding to begin to support these and other efforts. I was proud to help bring nearly $11 million of that funding to Indiana. Earlier this fall, the President rightly declared the opioid abuse epidemic a nationwide public health emergency. On the front lines in places like my home state of Indiana, however, the battle is raging. Despite a unified response, there's more work to do. Our governor, Governor Holcomb, has made the fight against opioid abuse the priority it needs to be. He and his administration are working closely with local communities to provide resources and support. Together, we've engaged our healthcare providers, both public and private, the business community, our educators, and the clergy, who are all committed to this cause. Yet the message I continue to hear from people on the ground is that we need more resources. We need to expand treatment capabilities as soon as possible. We all know this is not a partisan issue. Over the last few years, I've been honored to work with 7 of my Republican colleagues to introduce 7 bills and amendments addressing everything from prescribing practices to the shortage of addiction treatment professionals. And many of these ideas have already been signed into law. I'm partnering with my state's Republican governor to make sure we do everything in our power to help those who are battling with addiction. But it's not enough unless we provide our communities with the resources they're asking for and they need. This is the time of year that many Americans reflect on the year that has passed and identify the priorities in the years to come. In Congress, we need to do the same. More than 63,000 Americans died last year from opioid abuse. 63,000 moms and dads, brothers and sisters, husbands and wives, sons and daughters who are not here with us this year. We must make this issue a priority. I hope Congress will demonstrate to the American people that fighting opioid epidemic is a priority. One way to do that is to include meaningful resources in the bill to fund our federal government and key programs when we deal with this again before January 19th of next year. I implore my colleagues to make this a priority, to provide the robust, the meaningful funding our communities need to meaningfully and seriously address this problem. We are in the midst of a crisis. We must do more in 2018. We have families all across our nation with broken hearts tonight for the ones they love and the ones they miss. Let's make sure there's no more in 2018, that this ends today. Mr. President, I yield back.